Muted. The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. People are still joining, so we're going to start the webinar in just a couple more minutes. Please bear with us. We'll be back with you in 2 or 3 minutes to start. Well, good afternoon, everybody. Welcome to the third in a series of webinars we'll be providing on MACRA and MIPS. Today, we'll be focusing on advancing care information, otherwise referred to as ACI, and it replaces meaningful use as we know it today for the Medicare Part B providers. My name is Chris Conrad, and I'm the product manager at Amazing Charts for the Amazing Charts EHR product. And I'm here today with Chris Tremblay, Director of Product Strategy, and Kate Vanderweed, resident SME on MACRA and the author of the presentation we're viewing today. They'll be assisting with any questions and keeping me from straying too far off topic, which I can have a tendency to do at times. A recording of this webinar will be available on our website along with the prior webinars in the series, and we'll be providing more information on that later in the presentation. So let's talk about the subjects we'll be covering today. We're going to start with a brief overview of the basics on MACRA and MIPS to set the tone for today. We'll cover the basics of ACI and demonstrate how you can track them, the ACI measures, within Amazing Charts. Then we're going to provide a brief tour of the CMS's QPP website. It's very well done, and if you haven't seen it yet, I encourage you to spend a little bit of time acclimating yourselves to the tools they offer. It's very well done. And then we're going to show you the three differences between the three levels of participation: test, full, and partial. And then we're going to get into the ACI scoring algorithms. This can be a bit complicated at first glance, but we'll attempt to put it in perspective and keep it as simple as possible. I think you'll find it's really not that difficult if I can do a good job here explaining it. Okay, the next couple slides are just a recap of the program in general to kind of set the stage for today. The MACRA Act of 2015 created the Quality Payment Program, or QPP, a section within the Act aimed at paying clinicians for positive patient outcomes instead of volume of care. And under the program, physicians participating will be paid in one of two ways: via MIPS, which we believe most providers and the CMS will be paid in this manner, and via alternative payment models. This webinar is going to be focused primarily and, well, solely on MIPS. MIPS combines parts of PQRS, MU, and the value-based payment modifier into one system, and there's broken into measures or what we're referred to as categories, and they are referred to as categories. Quality, like PQRS, advancing care information, similar to meaningful use, improvement activities, and then resource use or cost. And that's not going to be applicable to 2017 reporting, so we won't be talking about that today. Now, each category is worth a certain amount of points. And when factored together, they comprise what is referred to as your composite score. And that score determines who will get an incentive payment or a penalty. Think of it as your final grade. The four categories are weighted. Quality, which is the focus of our previous webinar, comprises 60%, the majority of the total score. Improvement activities are worth 15%. And the topic for today, advancing care information, or ACI, is worth 25% of your potential score. And we're going to talk more about the scoring later in the presentation. Let's talk about timelines. This webinar series has been focused on the 2017 reporting period, and that is really the actionable period in which will impact your score. MIPS began on January 1st of this year, and the length of the reporting period is determined by the participation level, or path, that you decide to take. Given the current political climate, as well as CMS's and ONC's lack of clarity on what should be done for 2018, the requirements for 2018 are really undeterminable at this time. And CMS has stated that they expect to provide more information for 2018 reporting later this year. So what you do in 2017 and the path you take will determine your reimbursement rate for 2019. Do nothing, and you'll experience a 4% reduction in Medicare reimbursements in 2019. Now, since most of you are on the webinar, we can assume that you've decided to do something, at least given the knowledge that you have at this time. You can stay on your Amazing Charts 2014 certified version for all of 2017. We will be offering a new version of Amazing Charts, be referred to as version 10, late this year, which will be ONC 2015 certified. But you do not need that version in 2017. And we apologize for throwing all these different dates at you repeatedly, but that's the way CMS decided to name their versioning, which adds to a little bit more complexity. The version 10 that'll come out later this year is not required for 2017 reporting. Currently, the ONC is requiring that you be on the 2015 certified version, which will be our version 10, for 90 days in 2018, which would mean that you need to be updated to the new version 10 of Amazing Charts by October of next year, 2018. You do not need it by October of this year. So here's a quick review of the path that you may choose for 2017. All right? Do nothing and take the 4% reduction. Okay? Take the test path, as they refer to it, where you do the absolute minimum, and you will receive no penalty at all, nor are you eligible for any additional payments either in 2019. CMS really made this test path simple. All right, their goal was really just to incite providers to take some form of action. When you look at what it takes to do the test path, you'll notice like it's the bare bones minimum that's possible. We're not going to go into details in it today, but we recently posted a short tip sheet on our website within the last week that discusses the options under the test path. And in reality, if you understand how easy the test path really is, no one really needs to be taking any deduction in 2019. In our estimation, and we've colluded with some providers on this, you literally could get this with 20 minutes of effort in 2017. Okay, so then we have the partial participation, where you report on a small number of measures, and you need to do those activities for a minimum of 90 days throughout 2017. And then we have full participation, where you do as much as you can for as long as you can. Think of partial and full as being on a continuum. The more measures and activities you do, and the longer the period for which you report, the better your chances are of an increased Medicare payments in 2019. So let's start talking the focus of this webinar, which is the category Advancing Care Information, or ACI. And it's best to begin with some definitions which will help you understand the rest of the presentation. Advancing care information is a set of measures like meaningful use, but they're easier. There are no thresholds like there were in years past, no 50%, 25%, etc. All right? There are flexible reporting periods. There's a lot fewer measures, and every percentage point counts. All right? Measures have different classifications. All right? And first we'll have what's referred to as a base measure. A base measure is a measure for which you only need one in the numerator. And when we say that, we mean you only need to submit an activity for one patient, one event. Or you need to attest yes. And an example of that would be patients seen during reporting period must be sent a full patient record. All right, clinical summary. We've been sending those throughout. If you're familiar with meaningful use, been doing that for some time, sending the patient summary to the client's portal. All right. Then we have what's referred to as a performance measure. And these are measures where you get points based on how well you do, your percentages, numerator over denominator. And if you're familiar with the meaningful use wizard, you're familiar with what we're talking about. An example of that would be patient education. You get 33% on your performance measure, then you're going to earn 4 points. And we have bonus measures. And bonus measures are where you get a certain number of points for submitting to specialized registries, such as a QCDR, and we'll talk more about that in a little while. Now, some measures can be a base measure, but yet also a performance measure. In the example we provided above under base, provide patient access, is a good example. You only have to send a clinical summary to one patient to get credit for doing the base measure. However, you also can get additional points based on your performance, and that's based on your percentages. There is something special about base measures. You must do all of the measures classified as base if you're going to participate in the category of ACI. So let's talk a little bit more about that. There are 11 measures listed under ACI on the CMS's QPP website, and we're going to show that site in a moment here. Just to help you out if you haven't seen it already. There are two tabs that we're going to on the site, and we're going to concern ourselves with the tab on the right-hand side, 2017 Advancing Care Information. All right, they're different. All right, the percentages are different. And there's different measures, so we want to make sure we're focused on the one on the right-hand side because this is our transition year. While you have the option for other measures, the first 4 measures you see on the screen here are base measures, and they are required. So how do you know it's a base measure? If you're on the QPP website, or we provided all of this in this presentation, you click on and expand the measure, and to the right-hand side you're going to see required for base score. And note, in this case, it says yes. The e-prescribing measure is a base measure. In the lower left-hand corner, you'll see a box, Performance Weight Score. This one is 0, indicating that it is not a performance measure. For the e-prescribing measure, you only have to do 1 to meet the measure itself. And you don't get extra points for improved performance because it is not a performance measure. Okay, so in this case, we've clicked on and expanded the Provide Patient Access measure. Provide Patient Access is where you send a summary of care to the patient's portal within 4 days. Many of you are already quite familiar with this one if you've been participating in meaningful use, or even if you're not. Note that it is a base measure and also a performance measure. You can get extra points for doing more than the minimum of 1. Now let's look at a specific measure that is not a base measure, patient-specific education. You're not required to do this measure. It's optional. And you get points based on how well you do. And we're going to explain the whole points concept in a moment. So right now, if this works, see if I was set up properly, I should be able to flip over to the QPP site, but I apologize. I'm not going to be able to do that with the the settings that I have on the monitor at the moment. So, not a crisis here. There is a measure. Can I click on that? One moment. We may have a workaround here. Okay. Minor technical difficulties. Okay, this is the QPP site. All right. Now, it's worthy, if you haven't seen it yet, it's well worth to go through it. It describes the program in general. You've got separate pages for each one of the measure sets, the quality measures, which was the focus of the prior webinar, improvement activities, which we'll be discussing in an upcoming one, and advancing care, the subject for today. In the middle here, you can say you can report on 2017 advancing care. All right, if you have technology certified for 2014, which is applicable to us at this stage. So that's the tab that I referred to earlier when you look for your measures. So I'm clicking over here to the right-hand side on the 2017 Advancing Care Information, and this is the list of the 11 measures that I referred to earlier. All right. And if I click on, I'm clicking on e-prescribing, and as you can see, over to the right-hand side, required for base, yes, performance weight is 0, and a description of what you have to do here. Health information exchange, all right, and this is required for base, yes, and the performance says 20%. Okay, so this is eligible for up to 20 points. Another one, for example, these down secure messaging, and you can go through these on your own. Required for base, no. Performance weight, 10%. And then down further below, you also see the 3 bonus measures that are listed for registry reporting, syndromic surveillance, and specialty. All right, so encourage you. The link is in the deck, and it's also on our website under resources. So I encourage you to take it for a spin when you get a chance. There is some valuable information on it, and it's probably one of the better websites we've seen CMS ever do. Okay. Okay, so before we start discussing how you track ACI within Amazing Charts, let's talk about the minimum version of Amazing Charts you're going to need for 2017. You can use either a 2014 or 2015 version for 2017 under the CMS guidelines. And Amazing Charts has been certified since 2014, back in version 713. If you're on this call, then the vast majority of you have already been participating in Meaningful Use or PQRS, and you've learned that it is important to stay current with our releases to ensure that you have the most up-to-date software. So, any version of 9 will suffice for 2017 reporting. However, there are a few bug fixes in a couple areas that will benefit you, so it's highly recommended that you update to version 9.3 if you haven't already. Main point here, 9.3, remainder of 2017. You will not need an update. So let's take a look now at how you can track your ACI progress within Amazing Charts. Here are the 4 base measures again, the same 4 I listed previously on the screen and showed you on the QPP site. Your performance measures can be measured by using the Meaningful Use wizard in Amazing Charts, just as you've been doing for Meaningful Use these past few years. One exception, it's important to note that the directions, if you remember the panel to the right-hand side of the Meaningful Use wizard that talks about thresholds and how to do it, these directions are for modified stage 2. They do not reflect the current changes for participating in MIPS for 2017. So you'll have to follow the QPP site and this document that we're providing you. It's a very comprehensive document. Print it out, keep it in the side, and you can actually refer to this in lieu of any other information within Amazing Charts. All right, so in addition to e-prescribing, we'll take, provide patient access, for example. Where do you find it? It's in the Meaningful Use wizard. Modified stage 2, objective 8, measure 1. All right, security risk analysis. Something on security, if you're unfamiliar with the security risk analysis, we provided you with a link. There's a link on our website where you can fill out a form, and a representative from a partner of ours, Emerald Cybersecurity, will reach out to you and explain the service that they offer to help you complete this if necessary. We've been using them for quite some time. There is a cost associated with, based on the amount of detail that you need to report on. But if you need help in that area, we do offer a reference to this, a referral to this particular company. Health information exchange, again, where to find it, Meaningful Use wizard, modified stage 2, objective 5. I'm going to go on, and again, we're going to continue here. Provide patient access. All the measures are listed here in the deck that we provide you for future reference. We've also added in the total number of points that you can earn for each measure. And the goal is to maximize your points. If you're pursuing full or partial participation path, you get 50 points for completing the 4 base measures. The remaining 50 points need to come from performance measures. And here are the requirements and point potential for the remaining performance measures that we have out there. Again, your performance for all of these can be reported using the Meaningful Views wizard. And I didn't intend to talk through each one individually. We really made this so that they were self-explanatory and you can follow the directions. Exactly consistent for each one of the measures. So I also mentioned earlier the options for your performance points with participating in an immunization registry, as well as the syndromic surveillance and a specialized registry reporting. Now, one thing to note, the specialized registry reporting includes QCDRs. So if you are going to submit your quality measures through a registry, you're going to get the 5 points available here for advancing care, simply by using a registry. And we talk more about how to submit quality measures on the last one. One is through claims and others, but so you don't. But just keep in mind that you're going to get the 5 points if you submit through a QCDR. So now let's take a look about scoring and put it in the perspective of the participation paths I referred to that you decide to do. This slide encapsulates much of what we just covered. All right? If you choose to do tests, you only have to do one of the 3 categories. And this slide will cover how you would test if you choose to do only complete the ACI category. For the partial and full pass, you get 50 points for completing the 4 required base measures, and the remaining 50 points need to come from performance or bonus. Now we'll get a little bit deeper into the ACI category and composite scoring. First, if you're taking the test path just to avoid the reduction in 2019, there's not much to talk about here. If you were to choose ACI as your category while following the test path, you just complete the 4 base measures. You get 3 points and you're done. No deduction for 2019, that's it. All right, and you just saw e-prescribing, well, I described on a previous one, but that's it. And just as a side note, if you're taking the test path, or ACI may not be the easiest of your 3 options. It all depends on what activities you do today. So we suggest you explore the other options available to you in the quality or improvement activities categories first, because you may find that there's significantly less effort involved by taking one of those paths if you're opting to just not take the penalty in 2019. All right, so here we are. You've completed the 4 base measures, and you decided to report on one or more of performance measures. The number of points you receive is a factor of how many points it's worth and your final percentage completed. The higher your percentage, the more credit you're going to get. The percentage is the percentage that is in the Meaning Views wizard. If you're used to looking at that, it's numerator over denominator. That's the percentage we're talking about here. So if you have a measure and you're meeting it at 50% and it's worth 5 points, you get, or 10 points, you get 5 points. ACI, so you get 50 points for completing the 4 base measures. It's an example. Then you selected the 5 performance measures that I listed here. It's next to each measure is the percentage that reported from your MU wizard, 51, 83, 37, etc. All right? Take the first one, for example, provide patient access. You got 51%. It's worth 20 points. So because it's worth 20 points and you're in the 50% range, and it's that category, it runs between 50 and 51 and 59, or 50 and 59, you earn 12 points for that measure. Patient education, 83%, you get 9 points. You did very well on this measure. Then we look at view, download, and transmit, 11%, not so well. So you only get 2 points for that one. Now, something I want to mention here, and I don't want to confuse it, but remember that the points that we're talking about here for ACI category itself, okay, those 2 points aren't contributed towards your total composite score. What it is, the ACI category of 87 points in this example is worth 25% of your total composite score. Remember the earlier graph where I showed you that 60%, 15%, 25%. So when it comes down to it, the 2 points that you received for view, download, and transmit, that's only contributing 1/2 of a point towards your final score. So your total score, or composite score, is determined by taking the total points you're going to earn in each category and then multiplying it by its weighting factor. Quality comprises 60%. This was in the previous webinar we discussed. Improvement activities, 15% of your score. And today's topic, advancing care, is worth 25% of your total potential score. So let's put it all together. The total available points for ACI is 100 points. Okay? The ACI category itself is worth 25% towards your final grade, or composite score. So you take the 87 times 25%, and you just earned 21.75% towards your final grade. You'll add those points and those you earned from the other 2 categories, quality improvement activities, and that final score will be factored into any additional adjustments you'll see in 2019. Now we say may here because CMS is not correlating scores to actual dollar amounts. Basically, the better your score is, the better your chances are to receive a positive adjustment. So choose wisely. If you're really determined to maximize your opportunity, pick those measures that you'll do well on, and not just report on everything available because you're used to doing it. Otherwise, you could be investing a lot of effort into something for which there is no financial benefit if that's your primary reason for participation. Okay, so we're going to talk briefly about submission, and then we're going to wrap up with some Q&A. CMS is developing a website which will be available later this year, very similar to what you do now for meaningful use, and this will enable you to attest for your ACI. You also have the option to attest via a qualified registry or a QCDR. And I know this can be confusing, there are qualified registries, and then there are QCDR, they're quality data registries. Some, but not all, QCDRs, in addition to submitting your quality measures, will offer the ability to attest to ACI and improvement activities. You'll be likely using a registry or a QCDR to submit your quality measures. Okay, basically if you're not doing it via billing, you're going to do it through a registry or a QCDR. All right, those QCDRs are also going to give you the option to select the improvement and ACI activities and allow you to test on their website alone. So you won't have to go to different places to do this. And you're going to see a lot more clarity around this subject later in the year. A lot of this is still being developed and built out, and people aren't too concerned about attesting at this early stage. But it is good to have some concept of how you're going to go about reporting this in Q1 of 2018. Okay, so we thought we mentioned, I mentioned a little bit briefly, out on our website, we're continuing to add this to, there's a plethora of information. It's under amazingcharts.com, under support, MACRA and MIPS. You're going to find an FAQ, the timelines we discussed. You'll find a link to the past webinars. This one that we just will be posted within the next, let's say within the next few days. We've also tried to keep up and monitor blog posts and add anything on industry news. We'll be adding checklists. And we're continually adding more and more deliverables to this, so kind of keep out, visit us once in a while and see what we add. Under that section, there's also a list for the upcoming webinars. We have that coming on, quote me, I don't have it in front of me, but I think it's April 12th. All right, and I think registration will be open for that soon. Oh, I've just been corrected. It's already open. All right, and then the QPP's website here. All right, under CMS.gov, and that's the one I visited earlier, and we strongly suggest take a few moments to familiarize with it yourself. Like we said, it's probably the best we've ever seen. So now we're going to open up for a little Q&A. The Q&A questions could have been submitted. I think I forgot to mention that early on in the conversation, and nobody poked me. But if you have any questions, you can submit them through the window down in the lower right. Is it? I'm not looking at that.
So we're going to give you a second to write any questions that you have, and we'll take a pause here, and we'll come back in just a minute or two. In the meantime, we wanted to do a quick poll with 2 questions to get a feel for what you in the audience are doing for MIPS and advancing care information this year. So I'm going to put ourselves on mute and then ask those 2 questions. So you guys will see it pop up on your screen. Just you guys, I'm sure you see it there, but our first question is which path you intend to follow for MIPS in 2017. We know maybe you haven't absolutely chosen yet, but the 4 options are none. I will take the 4% negative adjustment. The test path, you only want to avoid a negative adjustment. The partial path, you want to try for a positive adjustment. Or the full path, you want to maximize your adjustment. We'll leave that open for another 15 seconds and then ask the second question. All right, we're going to go ahead and close this poll. You can share the results. Majority of you are doing partial or full. Our second poll is, oh, just kidding, that was the only question. Okay, but we are going to go ahead and answer some of your questions. Sure. The first question that we got asked was about basic eligibility, which isn't specific to the advancing care information topic, but we wanted to make sure to cover it. The question was eligibility for MIPS depends on whether you have a certain amount of reimbursements from Medicare payments and also the number of Medicare patients that you have. On our FAQ on our Amazing Charts website, we explain how you can add up those 100 patients. There's a specific time frame that you should be looking at for that. And if you go onto Amazing Charts website and then click on MACRA FAQ, it's under the Do I Need to Participate in MIPS question.
Didn't we hear also that the CMS was going to send something out in 2018 about that?
Yes, we've also heard from, when we asked the QPP this question, we heard from them that CMS is planning on sending out letters to providers to let them know whether or not they are eligible for MIPS. That was about a week ago, and they said they were hoping to get those letters out in the next few weeks. So be looking in your mailboxes for those.
Right. Basically, it was 100, if you've seen 100 patients or less in 2016, or you received $30,000 in reimbursements or less. If either one of those are true, you're exempt.
Correct. So it won't be based on your 2017 Medicare panel, but the number of patients you saw and the dollars that you collected in 2016.
One of the other questions was how and where do you report and attest for the advancing care information measures? That was covered on one of the last slides. CMS has told us that they are going to be creating an attestation website that works just like the one for Meaningful Use used to work, where you just enter your numerator and denominator or attest to having done the measure. That won't be out, however, until the end of 2017 or early 2018. So you can just rest assured that it will exist and you will be able to report your information. It's just not available to look at right now.
Great. Another question that came in, I think it's really important to address this again. If submission is necessary by March 31st of 2018, that would be for the 2017 reporting period, then how does this work if we won't have the upgrade available until the 2017, till the end of 2017, and we have to report a 90-day period? So let's go over this again. Amazing Charts is currently certified for anyone who wants to participate in 2017 on the MIPS program. The rules from CMS today state that you need to upgrade by the end of 2018. We've got all of the tools that you need to successfully participate this year. So although an upgrade will be required so that you get access to more features that are going to be required to be used in the 2018 reporting period, for this year you don't have to worry about an upgrade at all as long as you're on any version above version 9. So no worries on upgrades. You'll have what you need and your numbers will be accepted. All right, another great question, is Prime the qualified registry you guys are using? Yes, one among many, and you can also find more information on our website. We did include it in the quality webinar that we did, and we are actually planning another webinar specifically with the registry solutions so that you can see how easy it is to sign up and get your data over to them. Today, Amazing Charts has an existing integration for the quality data with Prime, so all of that would happen in an automated way for you if you choose to use them.
Someone asked if they don't meet the eligibility requirements, are they subject to the penalty in 2019? That would be a no. If you're not eligible for MIPS, you get off scot-free and you will not have a penalty in 2019. Another person asked how they can track their performance for ACI and Amazing Charts. Just wanted to clarify and make sure that was understood. In the Meaningful Use wizard, those measures under the core and menu that were used for meaningful use, those can be used to calculate the measures that are also getting reused for MIPS. You'll note that there are fewer measures in MIPS than are in the Meaningful Use wizard. That's why in the slides we noted that you could find that particular calculation for patient, provide patient access or e-prescribing. We noted where in the Meaningful Use wizard you could find that particular calculation, the numerator, denominator, and percentage. So there will be a little work you'll need to do just to make sure you're looking at the correct measure, but we've tried to provide the information that directs you where exactly you need to go so you don't have to find it yourself.
There's also a question out there of can you report on claims, and how do you do it? ACI isn't something that we can report through claims submissions. You can submit quality measures through claims, and I believe we just posted. We're going to post soon.
Yes, we've created a document following our test pass document that you can actually download in our handouts on this webinar today, and that is also up on our FAQ. But as a companion to that test pass document, we've created a how to submit a quality measure via claims. That will be up on the website either today or tomorrow under the FAQ quality measures section. So that's something that you all can look for as well.
Someone also asked about PQRS measures for 2017. And as it stands today, there is no PQRS submission for 2017. The program did end at the end of 2016, and MIPS is intended to replace PQRS in terms of quality, which is why they're allowing the same kinds of submission vehicles that were used under PQRS, claims submission, quality statistics from your EHR or from a registry that you're engaged with.
We did get a question about whether physician assistants are eligible for MIPS. That question is also on our FAQ, but just to read it for you, for 2017 and 2018, the following conditions are eligible for MIPS and therefore would be affected by payment adjustments for their participation or non-participation in MIPS, and that includes physicians, PAs, NPs, clinical nurse specialists, and certified registered nurse anesthetists. And that'll be for those who meet that 100 patient or $30,000 threshold. So just wanted to make sure that was understood. And again, that is answered on our FAQ if you wanted to read it again later. So another person asked how you submit through immunization and syndromic surveillance registries. That information is in this presentation. It describes exactly the steps you need to take to do both of those and any caveats to that. So please take a look at those slides where we describe each of the different measures and how to complete them in amazing charts. And that should help you out. We're getting some questions about quality, the quality category versus the ACI category, about which registries you should use or QCDRs. If you used one for PQRS and you're not sure whether you should use them again, our suggestion is that you contact that registry directly and talk to them about what they are doing for MIPS and what would be required for you. You can also look at our FAQ. I know I keep plugging this, but it has a lot of these answers. You can also look at the FAQ, which describes the different registries that you can choose to be involved with, some automatic, some manual. So that will be helpful for that question. If you are, we got a question that said, if you have less than 30K for Medicare patient volume in 2016, how do you let CMS know if you can be classified as ineligible? CMS is going to know. You don't have to tell them anything. You can just relax and sit back and not participate. We're just taking a look to see if there's any other questions. If we don't get a chance to answer your question on the call, we're going to be sending out a follow-up email that will include the presentation slides as well as answers to any of the questions that you guys asked that we didn't get to answer, as well as a link to the FAQ, which will be updated with any new questions that we got on this call today.
That's a question about 8.4 release.
Oh, we did get one question about whether reporting for ACI was practice-based or individual-based. That's a question that you get to choose yourself. You can choose to report as an individual or as a group. More information about how that works as an individual or group is on, again, our FAQ and on the QPP website that we showed you during the presentation. So those would be better places to ask those questions, but it is an option to do either individual or group reporting.
You also see a question on, I'm using currently version 8.2.4. Are there any changes in the menu wizard between versions? Yes, significant. So if you're on 8.2.4, we would suggest, and if you're doing PQRS reporting, you really want to be on version 9.3 to avoid, to make sure that you're covered for any bug defects or anything that we've changed over the last, that's a year plus old.
We also got a question about QCDR for neurology. I believe we do have information on all of the specialty registries, so we will send you, I just don't have it in front of me, so we'll send you a personalized response on that, and thank you for that question.
I'm getting some notes that when people are clicking on the PDF and the handouts, it says the page cannot be displayed. I'm not sure why that's happening. It's possible you don't have the Adobe version
up to date,
but these slides will be accessible in the email that we send out as well as on the website in the next few days. So if you can't see them here, you will be able to download them in the future, and we'll update you on where those are located.
Great. Do we want to share the poll results quickly before we break? Oh, you did? Oh, sorry about that. Great. Well, we thank you for joining us today, and thanks Chris Conrad and Kate for putting this information together. We realize that this is a really complex subject given all the changes. We do think for folks that are intent on just avoiding a penalty that will be very easy to do. No matter which category you choose, you'll be able to get through that pretty quickly and avoid penalty. As we said, we don't know what the future holds for 2018 requirements. We'll be sharing those as they come up. We strongly advise that if you are intent on full participation, that you do engage early with a registry solution this year. And the reason for that is because they'll also offer you a comprehensive way to track your quality measures throughout the year as soon as you can get that implemented and the data flowing over to them. That is 60% of the total composite score and is the place where you'd want to spend the most time trying to maximize how well you're doing. So for those that are going for the gold, get with a registry solution soon, and you'll get a level of comfort pretty quickly that you have something you can track throughout the whole year and also help submit at the end of the year. Thank you very much for your time. Chris?
No, thank you very much. And again, any of these questions that we didn't get to, we'll be sending out a response to everybody.
Thank you so much.
Thank you.